morning, Turks and Caicos. Welcome to another segment of Ask the Doctor. And of course, we have Dr. Nadia Astwood with us again. Dr. Astwood, thank you for joining us on Ask the Doctor. You're it.
Good morning, and thank you for having me once again.
So today, Doc, we're going to talk about non-communicable diseases. What are they? What are NCDs?
So NCDs are non-communicable diseases, which are chronic in nature. So you have communicable diseases, which can be passed from one person to another, such as an infectious disease. But chronic diseases, chronic non-communicable diseases, as we call them, are diseases that are of long duration, they're slowly progressive, and they don't pass from person to person. So the main types of NCDs would be the cardiovascular diseases, such as hypertension or high blood pressure, or ischemic heart disease, where your heart isn't getting enough blood or oxygen, cancers, chronic respiratory diseases, so these are your breathing problems, such as asthma, diabetes, and of course, any kind of mental health diseases.
Okay, so in relation to COVID-19, we hear a lot of talk about comorbidities and preexisting conditions making persons more vulnerable. Are these the same then as the NCDs, these preconditions?
Yes, they are exactly that, because we know from the evidence that's emerging about this new disease that persons with non-communicable diseases tend to have a poorer outcome. So they're more likely to die, or they're more likely to suffer the ill effects of this disease. And we know that as a country, the Turks and Caicos Islands, we have a high burden of non-communicable diseases. And so we know, from talking to our family members in our communities, that we have a high number of these diseases, such as hypertension, diabetes, and this makes us more vulnerable to having a poor outcome as a result of COVID-19.
So, Dr. Astwood, should persons living with NCDs take extra preventive and precautionary measures to maintain good health?
Yes, persons with chronic diseases should definitely take additional precautions. They should make sure that they continue to look after their disease. They have to continue to be compliant with their medication, take it as prescribed, follow their doctor's instructions, make sure that they practice healthy lifestyles, such as eating healthily, maintaining their physical activity, and whatever other advice that they've been given by their physician, that they follow it. So it's really important that they don't lose the focus on managing their disease, because by having tighter control of their chronic disease, they're less likely to suffer the ill effects of COVID-19.
Okay. I read somewhere, Dr. Astwood, that it's also important for these individuals presenting themselves to the public health team or to the hospital to know their medications. Why is this important?
Yes, well, it's always important to know their medication so that we can refill their prescriptions, to make sure that they're taking the correct medication, to make sure that they're taking the correct amounts of their medication. So we are in a shutdown, essentially, but there are healthcare services that are still available. And so when you see yourself coming towards the end of your prescription for your chronic disease, it's important that you present yourself early in order to get your refill. And then also, pharmacies are also an essential services. So they're able to go to the pharmacy and refill those prescriptions and take them as prescribed, which is so important at this time.
Yeah, I think you answered us, but just to recap, why are NCDs of concern in this global COVID-19 pandemic?
Well, we've seen, and the evidence is there all over the world, in terms of people with chronic diseases being more susceptible. So they're more likely to die, unfortunately, more likely to suffer the ill effects of COVID-19. And then we've also seen, from the US, people with our ethnic background having poorer outcomes because of our underlying non-communicable diseases. And we know that in the Caribbean, we have some of the highest non-communicable disease burden in the world. And so we really need to be very careful in terms of controlling these illnesses, the modifiable risk factors, such as practicing healthy lifestyles, so being physically active, eating a proper balanced diet, being compliant, with your medication, avoiding alcohol, avoiding smoking, etc. These are things that are under our control, that we can try and control our non-communicable disease in a better way, so that we are not at such high risk of COVID and the poor outcomes that it can be associated with.
Right. Along with the ethnic groups, there hasn't really been much information on the potential impact of COVID-19 on pregnant women. But with all the information we've now accumulated and with your medical expertise, how important is it for this group to also be careful?
Yes, well, pregnant women, should be very careful. The research is still evolving in terms of pregnancy. There have been reports of pregnant women having poor outcomes. So it's very important, because they have an additional burden on their immune system when you're pregnant. And so your immune system is already having a slightly compromised state as a result of being pregnant. So pregnant women need to be even more careful, but also to be diligent in terms of making sure that they're having a proper diet, that they're taking their prenatal vitamins, that they are following up and keeping their antenatal visits, and then as well taking the precautions when they go to the hospital to have the babies. So we have seen evidence of newborn babies being infected, but as we know that the secondary care facilities here and around the world have all stepped up their infection prevention and control, all the different measures to try and ensure that all of the patients entering the hospitals are as safe as possible from catching COVID as well as transmitting it. So everyone really needs to be very vigilant. The research and the evidence is still emerging, but everyone should take the extra precaution. And also, I have been, slightly concerned on the island that I live on, which is the capital, and seeing that people are really out on the streets too much. And so, again, I would like to use this platform to remind people that, really to stay at home unless it's really essential. I see a lot of people walking around, driving around, and it seems as if it's business as usual. But unfortunately, COVID is going to be with us for, the foreseeable future. And I really advise people to really take it seriously. Although we haven't had as high a number of cases as some other countries, we shouldn't be complacent. And if you're in the vulnerable groups, especially those people in the vulnerable groups with chronic diseases or the very elderly, really, if you don't need to be out, don't be out. You only need to go out for essential services, such as whether you need to go to the supermarket or the pharmacy or the hospital or any healthcare facility. But really, please stay home. Not only are you protecting yourself, your loved ones, you're also protecting the frontline workers.
Right. I think you answered our other question too, Dr. Aswad, as to how you would encourage persons with what you would encourage the persons with NCDs to do. So what would be your final words to our listening audience today?
Well, just the usual things that we like to reiterate when we talk about COVID-19. So take your medication, be compliant with your medication, ensure that you get your refills, maintain social distancing. So we talk about physical distancing, which is 6 feet away from other persons. If you have a cough, shortness of breath, or fever, please call either of our hotlines, 232-9444, 333-0911, and avoid going straight to the healthcare center. If you call our hotlines, we can give you advice on what to do. Please remember to wash your hands frequently throughout the day with soap and water for at least 20 seconds. If you smoke, quit smoking. It's always a great time to stop smoking. It's not the best, and it's not a good coping strategy. Avoid excessive alcohol. Also, we have to also look out for people's mental health at this time, because it can be quite isolating. Yeah. So reach out to your loved ones, use a phone, use the internet, use Skype, use WhatsApp or whatever to keep in touch with your neighbors, attend your virtual church services or meetings, try and develop hobbies that can help pass the time. Make sure that you're getting an adequate amount of sleep. Be sure to exercise. The laws are flexible enough to allow exercise between 5 and 9 a.m. each morning, or 5 and 7 p.m. Daily for 1.5 hours per day. But when you do exercise, please maintain your social distancing. And again, please stay home unless it's absolutely, absolutely necessary for you to go out. So, I encourage everyone to look out for one another and to stay safe. Follow the advice that's out there from the Ministry of Health. We encourage you to go onto our web page or our Facebook page to get any additional information. And on those pages, we have email addresses. You can contact us if you have any queries. But please, I just want everyone to stay safe.
Thank you so very much, Dr. Astrid, for joining us again on Ask the Doctor. And as always, we wish you and your team well, and we thank you so very much for what you're doing to ensure that we stay as safe as we can. Thank you very much.
Thank you, and also thank you to all the frontline workers who are also working for us as well. I appreciate all of their support because they are working so hard and putting themselves on the front line to work for us.